Hi everyone, I'm Dr. Shim Ching, board certified plastic surgeon in Honolulu, Hawaii. Today we're going to be talking about breast augmentation and breast lifts. This is a very common question that I get. Do I need just an augmentation or do I need a lift? And the answer really depends on the patient. Every patient is different. Some patients, we really only need an implant to, of course, make the breast larger, but also lift the breast. Generally, this is because there's less drooping, and an implant alone is sufficient to lift the breast from the inside. We often can do this procedure in a way we call a no-scar breast lift, where an implant is placed over the muscle in a special way so that this lifts the breast from the inside, and no breast lift, which means taking out skin and breast tissue, is required. As the degree of drooping gets more and more, a breast lift is required. This usually means taking out skin or skin and breast tissue, which leaves some form of scarring on the breast. I like to perform a breast lift with just a scar around the areola. This is less of a scar. We call this a halo lift. When we combine this with an implant placed over the muscle, it is a very nice way to lift a breast without actually having to create obvious scars on the breast. When we're in a situation where the breast is too droopy, then a full breast lift with usually what we call anchor-shaped scar is required. And this is a procedure where we usually use an implant. However, this procedure can be done without an implant. Once the implant is inserted, we create scars in the breast that allow me to lift the breast in a maximal fashion. And this requires an anchor-shaped scar, which is a scar usually around the areola, vertical scar going down, and a scar that goes across the chest where the breast meets the chest to fully lift the breast. Healing time from implants alone can be as short as 2 or 3 days to go back to light work. Light work meaning desk work and a computer on the phone at a desk. For breast lifts, because it is a larger procedure, recovery time can stretch to 1 to 2 weeks to return to light work. An ideal candidate for this procedure is any woman who's dissatisfied with either the shape of their breast, the size of their breast. All of these things can be addressed with implants and a breast lift. So women are usually quite concerned about any scar in their breasts. Scars usually take 1 to 1.5 years to fully mature. So they will go through phases where the scar is going to be more red, more swollen, usually at about 3 to 4 months after surgery, and then from there fade and ideally be very minimally visible, a fake white line on the breast. And that's always what we strive for. All patients heal differently. Some people have scarring that's more obvious. Some patients have very minimal scarring. We always try to create the best scar possible for every patient, and after that it is up to a woman's body how they choose to scar. But there are ways that we can minimize scarring as much as possible, even if the scar is more visible after this period. Thanks so much for watching this video. I really appreciate it. If you have any comments down below, please let us know. Please smash up that like button, subscribe to our channel. Thank you.